Wonderful. Well, it's so nice to be here today. It's spring again, and it just somehow makes it even more wonderful to be together and to see sun outside. So today I'm going to be talking about something that we do all the time in clinic. We talk about risks and benefits, and we make decisions about medicines. But I'm going to take a step back and think a little bit more about how we make these decisions and what influences our perception of risk. Can everybody hear me okay? Good, yay. Okay, wonderful. So nothing in life is simple, right? We know that everything has a benefit, everything has a cost, and that is true especially in medicine, where there are so many shades of gray. And so what we need to think about in terms of decision-making around medicines is a framework of assessing both the risks and the benefits and putting them through the lens of our life and thinking about what makes sense for every one person as an individual. And you all will probably know this, but I'm going to do a spoiler alert already. There is no cookbook for this. There are trends about medicines to choose in different scenarios, but really every patient is an individual, and we need to assess risks and benefits on the individual basis to make the best decisions. So some things we might look at and agree. Oh, that looks pretty risky. Jumping out of a perfectly good airplane, that's not for me. Other things we might look at and we might disagree. You might look at a hoverboard and say, oh, that looks pretty safe, might be kind of fun. I, with my pediatrics training and being a mother, look at that and think, nope, not for me. Some things we look at and we think, oh, that's probably pretty safe. I drive every day. I've been driving every day of my life. Then the statistics might disagree with us. Again, my pediatrician hat looks at a trampoline and sees broken bones and x-rays. So everybody's risk assessment is a little bit different, and it comes down to risk tolerance. How much risk are we willing to accept in our life? And some of that, as we're going to talk about, is a numbers game, looking at data. A lot of it is looking at our personal experience and thinking, oh, I've been flying lots of times, at least post-pandemic. That's probably safe. And some things we look at and we see, oh, that looks pretty risky. That person could be free climbing on the side of El Capitan. But what if they're also bouldering? What if that's just someone 2 feet off the ground? What looks like something really scary to us might actually be something quite safe. So we need a framework for thinking about things, how they're risky. And again, you can't judge by first impressions necessarily. So here's some framework, some things to think about. What is the likelihood? This is a game of odds. When we think about risk, what is the likelihood of this risky outcome that we're thinking about? And how bad is it? Something really rare but really bad is going to convey a different sense of risk to us than something that might be pretty common with a less intense risk. And what are my experiences that are framing how I look at that risk? If I've just recently been in a car accident, I'm going to think about that road trip to California a little differently than if I have been driving for 10 years without a car accident. Another experience or circumstance I've sort of hinted at already, but as a parent, you may choose something different for your child or your dependent than you might choose for yourself. So maybe your own risk tolerance, maybe you're a thrill seeker, maybe you love skydiving, but you would never let your child do that. Your role as a parent or a caregiver can influence how you assess risk as well. So here are some of the numbers, just to, again, put together a few things by comparison. So as we think about risk, we can think about the numbers, but also recognize that's not all that there is in a risk assessment. So this was horrifying to me. 1 in 5 people, Americans, this is American data, will die of related causes to coronary artery disease. So heart disease, that is a lot. I would say that's a pretty high risk. And yet some of us may still identify cheeseburgers as our favorite meal. And so again, this is one way of thinking about risk, but action and risk may not correlate there. Risk of dying in a car accident, this is over a lifetime, 1 in 100. That, to some people, sounds like a pretty small number. To me, that again sounded kind of high. 1 in 100 over a lifetime are going to die in a car accident. Now, here's an MS-specific risk, and this is pertinent to patients with MS who are on Tysabri or natalizumab. If you're on this medicine, we spend a lot of time talking about risk, and that is because we figured it out, and we know that there are rare but bad, a rare or and bad side effect of being on natalizumab. That is related specifically to the JC virus. And that range of 1 to 1,000 or 1 to 10,000 of this very bad outcome can feel really, really high, even though when you compare it to things like dying in a car accident, it's less likely, 10 to 100-fold less likely than dying in a car accident. And then we think about other things like getting struck by lightning. Well, thankfully, that's not common, unless you are a hiker and you like to go to the top of 14ers in summertime in the afternoon. Well, then your risk might actually be higher than this approximate of 1 in 1 million. I wouldn't recommend any of that, by the way. Summit early and get off the mountain. And then, dying in an airplane crash. Well, again, this is American data, 1 in 11 million. So even though we turn on the news, and especially lately, there have been a lot of airplane accidents, we can still look at airplane travel and see by the numbers that, oh, this is still a pretty darn safe way to travel. So I put this out there as a framework to think about risk. Now, as I've mentioned already, though, everybody has a risk tolerance that is more than just the numbers. It has to do with your lived experience and who you are. Now let's pivot a little bit and think about benefits. So everything, most things, I would guess, have a benefit in relation to a risk. And we would never do anything that was 100% risky. We take steps, we make decisions because we believe there is some benefit that is going to offset that risk. So what is it that's valuable to me? What is the benefit I am hoping to get from this medicine? And is it going to help me to achieve my goals, whatever they may be, now or in the future? So benefits. Maybe the benefit that we're striving for is a restful night of sleep. I know there were questions about sleep submitted. What if we could have a night of sleep without pain or spasticity? That would be a benefit. What about the ability to exercise or participate in playing a sport? That's a benefit. For that, you might be willing to accept some risk. What about being present for family time? That's definitely a benefit that people would work towards. And then reading a book, looking at things with small font. Whatever your goal is, these are the benefits that we need to be conscious about to balance out the risks that we may take with the medicines that we choose. So now let's transition and talk specifically about MS and the importance of disease-modifying therapies, which I may refer to as DMTs also. These are the medicines that are sort of foundational to treating this disorder. Medicines that we believe will slow down the progression. I know that's a topic of discussion today. Reduce or eliminate relapses, things that take you out of your life that may require more acute treatment and unfortunately potentially leave you with symptoms afterwards. All of this to minimize new brain or spinal cord lesions. So I've already mentioned it, but I'll reiterate that all treatments come with risks. And so some of them are common and manageable. And so if we know that headaches are going to come with this treatment, but they're pretty easily managed with Tylenol or ibuprofen, that is a smaller consideration in the scheme of things. What if they're rare but serious? I've kind of hinted at PML with Tysabri. This is a pretty darn rare disorder, as I've shown you, but it can be pretty bad. So we have to think about that as well. What I will also say about this is that what I see tormenting my patients sometimes is not what is known specifically about a drug, but the fear of the unknown. So I know that this drug was tested, it received FDA certification, there was a 12.6% rate of this in the trials leading up to it, but I know my luck. My luck is terrible. I know I'm going to have the side effect that wasn't even reported. That is the kind of unfortunate torture that is just really hard to address because we can't disprove that. But we also, I want to acknowledge that that unknown may not be the reason to make a decision of one medicine over another. So I think this will be old news for everyone here in the room, but just to review, there are 3 different mechanisms by which our medicines, our DMTs, are given. And in the injectable category, I've excluded ofatumumab, one of our newer medicines. And I've put up there how strong they are versus how risky they are. It's, again, a means of looking at benefit versus risk. So our oldest medicines, the injectables, again, except for ofatumumab, not that strong. They're better than nothing. And when that was all we had, we felt pretty good about it. But they're not that strong. The benefit is low. But conversely, the risk, pretty low as well. And now we've had decades of experience with them, so we feel like we know them pretty well. Pills, those have moderate strength, so moderate benefit, but probably carry more risk too. Risk that is important to manage with different things like blood work and regular exams. And then our last category, infusions, and I've put ofatumumab in with this group as well. Strong medicines, we use them a lot, also carry a higher risk profile that we need to manage and be aware of. No, ofatumumab is Kesimpta. Ocrevus is one of the infusions. So that's that 3rd category. Thanks for the clarification. But the benefits of DMTs, again, fewer relapses, slowing disability progression. For some people, they may even note improved mental clarity, less fatigue. And then, of course, something we're always looking for are lesions on MRI. No new lesions is good news to us. And protecting our precious resource, our brain, it really is what we need to protect long-term with MS. So choosing the right DMT for you. Again, everybody is an individual. I loved hearing that in the prior discussion. We really need to think about this as a balance of risk and benefit for every patient within the context of their own risk tolerance and their circumstances, where they are in life. And finding the best medicine to improve your quality of life, to bring that benefit above the risk in everyone's mind. So here are some questions to ask. How active is my MS right now? If it is like a runaway train, you're going to choose differently than if it's been calm for some time. How quickly do I need the treatment to work? Again, this means, some of the medicines that we choose, they work very, very soon after taking. Others need some time to ramp up. How do I feel about the possible side effects? Again, what is the lens that I'm looking through in terms of the risks? And then life plans, pregnancy, travel, work, all of these things can influence the choices that are made. Blood tests. Well, you may know if you're one of our patients that we do blood tests regularly and for good reason. It's a means of mediating, managing the risk. And then I put down at the bottom a reminder, thinking back to the numbers page, even higher risk medicines have a lower risk than that of a car crash. And so keeping that in mind as you're weighing your choices can also help give perspective. And of course, working with your doctor together to make the right choice based on all of the things that we have talked about. Now, I've mentioned the DMTs so far, but I wanted to take just a minute to talk about symptom control. Symptoms are things that you experience because of MS. And unfortunately, MS is a disease that, based on where the attack has happened in the central nervous system, can leave you with symptoms. I've put just a few here. Spasticity. What are the different things we can do to minimize, to control, to improve spasticity? Well, there are many things, one of which is one type of intervention are medicines. Baclofen is just one example. Gait problems, unfortunately, very common. There are things that we can do. One of the things we can do is a medicine. Sleep problems. Yes, again, many interventions to help improve sleep. Occasionally, we'll use medicines for those as well. And physical therapy to help with pain, but also medicines to help with pain. And I know there was a recent question about gabapentin and complementary therapies. So all of the risk and benefit analysis happens not just around medicines, but around these different interventions as well. So in considering the different symptomatic treatments, if you are talking about medicine specifically, or what are my treatment options? What side effects should I know about and be looking out for? Do I need to have more frequent visits to the doctor or more frequent blood work? What happens if it doesn't work, and when to let your doctor know? And how, again, the medicines might affect life plans like travel, pregnancy, and work. Now, before I end, I just wanted to pause for a minute and say very, very few happy people post on the internet. And so, buyer beware. If you are on a forum, and there are so many for patients with MS, and you hear of a negative side effect of this medicine or the other, keep that in mind. For everything that you hear about something that's gone wrong, there may be 100 or 1,000 other satisfied customers that are not posting on the internet because they're feeling good and they're doing other things. So use that lens of skepticism when reading things online to make sure that you are not hearing the loudest voice, but which may be the most inaccurate voice in the room, so to speak. And then, of course, check with your doctor, talk to your team, go to trusted websites like mscenter.org and National MS Society. And you can even check official medication guides, although quite honestly, sometimes those scare me too. So with that being said, again, there's no cookbook. It's not that easy. There's no one size that fits all. You, of course, have a say in your care, and risks do feel scary. but understanding how likely or unlikely they are and what steps you can take to mitigate that risk can really help to put things in perspective. And of course, lastly, we're here to help. Okay, thank you.